Hey yo, tomorrow I'm going to be releasing a video that contains information about recent experience that I heard from a person that I'm working with and that I'm helping get their Medicare straight. And I wanted to elaborate a little more on this one because the one I'm gonna be releasing tomorrow, it's within like 2 minutes, and it's a long story. So I wanted to give everybody a little bit of context. Um, so the family calls me, and the gentleman uh, has had a procedure, surgical hip replacement, right? And this was about a month ago, I believe. And when they are at the nursing facility or rehab facility post surgical procedure, after a few days, their their days with the plan that they have are exhausted. If you don't know this, plans have different protocols and different um, we call it benefits, but it's all of the benefits are designed based on some protocols, medical protocols that are established uh, by government, and and then the insurance carriers design their plans to fit what the government allows. So let's say a plan has a nursing home um, protocol per Medicare that allows 20 or 30 or 100 days. Well, the insurance carrier has to abide by those rules. That's just to give you an idea of how it works. In this case, if you're not on Medicare, you will find out. And of course, I'm an agent, so you can reach out and ask me anytime. When you are at a rehab facility or post-surgery or surgical, rehabbing nursing home, something like that, facility to recover, you get an X amount of days. By Medicare standards, you get a set of days, and then you'll pay according to the amount of days that you are in the facility. When if you haven't seen any of my other videos and you are turning 65, if you were born in 1960, with Medicare, for those of you that don't know, when you are on Medicare, straight up Medicare, original Medicare, for those of you that are thinking about it, you have to incur in a deductible, and then you'll pay per day for a certain amount of days, and that's how your bill comes to you. Let's say the per day amount that you have to pay, let's say it's $200 per day or $50 or 100, then you'll multiply that per the amount of days that you were in the facility, and then you get your bill. Before the plan starts covering, you have a deductible. All the health insurance plans have a deductible. Medicare does have a deductible. And so you have to pay your deductible, then you have to pay the per day amount, or co-insurance. With Medicare, it's usually a co-insurance, or it could be a combination of both, a co-insurance and a per day amount. That's with original Medicare. That's why some people choose, once they are within the stage or that time frame to make a decision, they either take a Medicare supplement, which we suggest a lot, or they take a Medicare Advantage, which we also suggest a lot, depending on each situation. There's a lot of details that go into that, and a lot of factors that go into the equation before someone makes a decision. But in this case, this family, the husband had Medicare Advantage. The sad part is that when you're in a medical facility, you're at the mercy of professionals, and you want to get better, of course, and you want to follow the rules, because common knowledge tells us that if we don't follow the rules, we could get hurt, right? And everybody reinforces that. We've been taught from the moment we were little kids to follow the rules. Otherwise, there's a reaction, a result. So imagine you get your procedure done, and then you hear that because you have a Medicare Advantage plan, your Medicare Advantage plan says that you only get like a week or 2 weeks or 20 days. And then from that point on, they got to release you. And sometimes some people feel like, man, that's not enough. I don't feel well. And that could be the case. None of these plans are perfect, by the way. And there's no plan that covers everything. But so the family has Medicare Advantage, and in this case, what the nursing home staff decided to do was to advise the family that to drop their Medicare Advantage plan, because in their eyes they could get more days, more coverage. They could stay for longer in the rehab facility than if they kept their Medicare Advantage. With the Medicare Advantage, once you exhaust your time, you really gotta go home. Otherwise you're gonna pay out of pocket. When you're on Medicare, there's no stopgap. You need to know this, very important. If you are on original Medicare, and some people initially, once they when they don't know, when no one explains to them, they think, well, original Medicare is everything. Why would I want to limit my original Medicare? So they go ahead, and some people do decide for that, but I advise against that. Anyways, they advise this family to drop the Medicare Advantage plan. Some professionals do advise it. They advise this family to do that. In my opinion, it's very irresponsible. First of all, the nurses and doctors, billing staff, administrators, hospital administrators, none of these people are licensed agents. We go through a lot of licensing requirements, training, education, continuing education, checks and balances. A lot of systems are in place for licensed agents to make sure that we provide not only objective but advice that is going to help and that is going to be a real solution to the problem. And I'm not only talking from the moral standpoint, I'm actually talking about dollars and cents too. Sometimes we have a bad rep because there's agents that don't care and they do what's best for them. And yeah, we have to own that. There's a lot of bad apples out there, but most of the agents that I know really care. There's thousands of us out there that do care, and anyone that is worth their weight in salt would never, right in the middle of this process, advice of dropping their plan and going to original Medicare. The only reason I find that these people do this, and this could get me in trouble with them. I don't care, honestly. I don't care. I'm not saying anything illegal or untrue, that is not factual. Most of the time, these people are making their decision, giving you advice from the financial standpoint. They just want to get more time, want to get you to stay in their facility for a longer period of time, and honestly milk the system. That's the sad reality. They work for an employer. It's the bottom line. Guess what happened to this prospect? This soon to be, I'm 100% sure that I am going to help them and they will be my client forever. They got a $4,000 bill. Now they're home, and they did get a couple extra days in the nursing home, and the nursing home bills Medicare, but the 20% and the extra expenses, they don't say, oh no, we'll help you with that. No, they immediately print a bill and send it to the family. Even if you are still recovering, they are still going to send you that bill. So they got this bill, and now an agent like me has to come and do education or re-educate, because I'm pretty sure the first agent that had him on the Medicare Advantage did the education. But imagine you're in the, again, like I said, you trust the people that you're surrounded with. These people are taking care of you. You do not expect that they're gonna like take advantage of the system or try and milk the system for more money, but they do. Anyone that tells you to drop your plan, you need to be really cautious with. There are situations that do merit changing. That's why we do reviews, annual reviews. That's why sometimes people reach out and say, hey, can you check if I'm still on the best coverage, etc., or I'm gonna have this situation. Do you think there's a better route for me, or can I improve what I already have? Yes, we do that all the time. I'm licensed. I wouldn't take medical advice from my let's say from my gardener, from the guy that does the yard for me. I wouldn't take financial advice from my doctor. I wouldn't take YouTube lessons from someone that is in the medical profession, or from an agent, from an insurance agent. I take YouTube lessons from YouTubers. I take financial advice from a banker or a financial advisor. I take medical advice from a doctor. And yeah, I just want you guys to know that this is really scary to get a $4,000 bill while you're trying to recover. And just beware. There's people out there trying to milk the system, and if you ever need help, just reach out. This channel is for you. It's for this reason alone. We talk about Medicare and all things Medicare, and if you ever have a need and your agent is not able, or you think they don't know, just reach out, ask the question, and if they have done a good job, we'll let you know too. Okay, take care, please. Peace.